Are you suffering from pain in your butt that radiates down your leg? Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. And in this video, I'll be discussing about Piriformis Syndrome, or an irritation on the sciatic nerve, not from your low back or stenosis or disunion, but due to tightness, weakness, or trauma on your piriformis muscles. So in this video, I'll be discussing the anatomy of the piriformis muscle, the causes why you're having it, and making sure you know the special test to figure out if that's the root of your problem before you proceed to any exercise routine. My best recommendation is to still see your local physical therapist or primary care physician to make sure you have the right diagnosis. And in this video, we're going to do some lovely strengthening of your core, your piriformis muscles, how to test it, and utilizing tools like a foam roller and the ball to relieve the tightness, stiffness, aches, and pain. If you're new to my channel is about Pilates, yoga, and physical therapy, and my name is Annie. I'm a physical therapist for more than 20 years, and welcome to my channel if you're new, and welcome back for those who've been following along with my videos. And if you need my help and guidance, hand-in-hand approach with my weekly Zoom call, click the link on the description below and sign up on my back masterclass, and I'll be closing the cart tonight, so don't miss out on this opportunity. And you can use a special code BACK30 and get 30% discount. Only once in a while I do a discount code on my back masterclass, so don't miss out. Join my small intimate class and weekly Zoom calls so I could help you reach your goals to be pain-free, to have a stronger core and improve overall posture, and to know what's going on your back health. So let's begin the program. So let's talk about piriformis muscle. So a piriformis muscle is a flat-shaped muscle that runs from your low back, wraps around, and inserts on the front of your thigh. It helps external rotate of your hip, and that's why it's a very important muscle, because if you're tight and you're sitting a lot, it causes compression on the sciatic nerve that passes behind it. But there's 1% chance in the population genetically, there is a chance the sciatic nerve passes through the muscle, which happens also to some of my patients. And when you have trauma on your buttock, especially in one side, or scar tissue buildup, that also causes Piriformis Syndrome. So you want to make sure you don't have sciatica due to disc herniation or lumbar stenosis. You have to figure it out through special tests. So one of the special tests that I do with my patients, when you lie down on your back, you do a Lasega test or straight leg raise test. With your leg down, with the other knee bent to protect your back, I actually lift the patient's leg with the knee straight, and if there's a shooting pain down the leg, it's from the back. However, if you just feel the hamstring tightness, then that's just hamstring flexibility. But for the piriformis, you do a figure of 4 or Faber test, flexion, abduction, external rotation, and you push out and you bend your knee to chest, and they're shooting down the leg. Then you're stretching the piriformis muscle, and then it compresses the sciatic nerve. So those are the 2 tests you can do right now if you want to figure it out. But of course, my best recommendation is to still see your local physical therapist and primary care. So the first thing I do with my patients, of course, is to do some gentle hip opening. You don't want to force the figure of 4 first, because that's going to aggravate the condition. You want to slowly build the strength of your piriformis muscles. That's why I have the elastic band that I utilize to my patients, and you wrap around your thigh. Usually I do this the first week to 2 weeks of my session. Is a lot of gentle hip opening, a little bit marching for core stability, clamshell, reverse clam, and so on. And I utilize the ball for stability to strengthen your core. So first, you lie on your back. So hip opening is a great way to slowly open your hip. So most patients with Piriformis Syndrome, I notice their lifestyle is a lot of seated position that causes compression on your buttocks, and then the piriformis muscle gets really tight. And the piriformis muscle, when you open one side, you want to make sure you include your breathing as you inhale, exhale, open one side. So gentle hip fall out, with the elastic band. If you find the elastic band too challenging, then you can also remove it. But for those who want to start building strength, then you place the band. As you breathe in, breathe out. Zip it up from your lower abs to your navel. Engage your abdominal muscles so you're not twisting your spine. And you want to make sure your lumbar spine has a little bit space. You can place one hand at the small of the back to give that natural curvature, a little bit neutral position. You're not flattening your back and you're not overarching. Again, breathe in, zip it up, exhale, and open. Slow and steady. You don't have to open all the way to the point you're twisting your spine. You want to keep the other knee pointing to the heavens while you open the other leg. As you breathe in back to the center, breathe out, open. You can see my other knee is pointing up and the other one is hip opening. You're going to feel a gentle stretch on your hip groin area. Breathe in and breathe out. Last one. And that's the first one that I do to my patients. And after doing some gentle hip opening, I usually ask them keeping that neutral spine. So place one hand at the small of the back, one hand on your abdomen. As you breathe in, breathe out to tabletop. Just bend your knee to 90 degrees. Keep your other knee bent, toes pointing away. As you breathe out and inhale down. Alternating left and right. So if you place your hand at the small of the back and you notice when you lift your leg, you're starting pressing, I would rather keep it arch and make sure you're not pressing at the back of your hand. So slow and steady, you alternate left and right. Inhale, down, exhale, switch. 2 more. So after that beautiful gentle marches that I give to my patients and their hips are getting warm up, now we're going to challenge with tabletop. And once you reach that tabletop, you do a gentle hip opening. If you notice, I'm still keeping my pelvis squared. If I place a cup of coffee on top of my abdomen and my pelvis, as I open, I'm not leaning to the left. So I'm opening my knee and foot out there, aligned together, not kicking out, keeping it aligned with your knee, and then back center, and then down. And then switch to the other side as you breathe in, breathe out, bent, open, center, and down. You breathe in, breathe out, squeeze your core in, tabletop, open, keeping that back pelvis stable, center, and down. Inhale, exhale, lift. I'm switching to the other side, open, center, and down. Last set, breathe in, open, center, down, and last set on your right. Tabletop, open, center, down. And after lying on your back, now let's challenge lying on your side. So if your problem side is your right side, you lie on your left. And my recommendation is just do the injured side for now. Especially if you lie on your right side, you might feel a lot of irritation and pain. So with this position, you want to make sure you slightly lean forward. Use the foam roller between your knees for that beautiful spacing a little bit, so that you are a little bit 90-degree leveled with your aligned, not 90 degrees, but your knee and hip are aligned as you lie on this side. We want to start with your feet together. And from this position, we're going to slowly lift up your foot. Both foot up, feet up, and down. Just warming up your pelvis back and forth with the foam roller. Just gentle mobility of your hip on your right side. As you breathe in, breathe out. Squeezing your core in as you try your best to lean forward gently. So this is 36 inches. So as you lean forward, it's going to tap forward and back. Just a gentle range of motion. And now we are progressing by placing the foam roller between your feet. So now you have a little bit elevation on your foot. So from this position and having that foam roller aligned, now you can do a gentle clamshell, keeping that foam roller together and open. You want to make sure you're not leaning back. You want to lean forward to really target your glutes. As you breathe in, breathe out. Squeeze your core in. This helps strengthen your piriformis, but having that foam roller on your feet give that a little bit instability and mindfulness, so it's a little bit shaky, keeping it aligned. So you're not just doing clamshell like this, fast as you can. You want to be mindful with your breath work. So when you go up, you want to make sure you're really aligning with the motion, keeping it straight and lift off. So keep it center between your leg, near your ankle, and up. So it's a lot more work even in the lower part of your pelvis. Open as much as you can without twisting your spine. So it's a little bit more challenging with the foam roller. Last set. And after doing that beautiful clam, you're going to place it around your ankle, the band, and then the foam roller between your knees. So from this position, keeping your knee aligned, and now you can do reverse clam with the foam roller between your knees. As you breathe in, down, breathe out, up. And my recommendation is to do that 10 repetitions and hold it up to 10 seconds if you can. Last set. And after doing that, now we can do parallel clam. Hold on to the foam roller, making sure your knee and your foot, they're parallel together. And then down, don't lean back, keep leaning forward. Last set. Well done. Now let's glue them together by doing some bridging, using the ball for instability. When your knees are bent, you're targeting your hamstrings. As you bridge up and do that 2 seconds hold 10 times, and then just target your glutes with your knees straight and bridge up. And those muscles, hamstrings or glutes, will support your piriformis. And the last progression with the ball is bridging in the butterfly position. So with your knees out, hold the band, keep it aligned around your knees, and bridge up. So this is the third progression. If you're feeling like you're losing your balance, hold on to the mat and bridge in the butterfly position. That really strengthens your piriformis muscles, your hip external rotators, as much as you can tolerate without pinching the sciatic nerve. I'm hoping you enjoyed this quick, direct piriformis using the ball and the foam roller and elastic band. I have a lot more Piriformis Syndrome videos you can add together with this one. You can figure out each one that's worked for you, because as we slowly progress, listen to your body. And if there's any inclination of shooting pain down the leg, especially after the activities, you're going to feel it, like climbing stairs, running activities, high impact activities could trigger it more. Right now, I'd rather you put heat on your buttocks, stretch, and do these exercises. I'm not showing you a lot of piriformis stretches yet, and that's why I have another video you can follow along. This is more stability on the muscles before you stretch, because sometimes stretching it will cause more irritation on the sciatic nerve if you don't build strength. And I've seen it in my program. And if you need my help and guidance, sign up right now in my back masterclass before I close the cart. So see you inside the class. If you have more time today, watch this video about my episode 1 about proper breathwork and episode 2 on how to learn the gravity-assisted foam rolling and posture exercises using the foam roller. I'll see you in my next video training. Always remember, be safe, be well, and healthy you. Bye!